have a chance to throw me out. Okay, how are we doing?
Good.
I see Linda's here, Jeannie's here, Krista's here.
I'm getting
Dr. Kurt.
Lindsay. I'm getting Lindsay to send Patty another invite.
Got it. Okay. And then is Dr. Kurt here or Bill Madsen? I don't see him yet. Let me check.
Bill's here.
I'm here.
Bill's here. Great. Hey, Bill. How's it going? Glad to see you. Tori's here. And then so Dr. Kurt hasn't come in yet, but I think we have a quorum. Is that correct? Suzuho, Lindsay? Great. Thank you. I think we should get started. This is the August Board of Health meeting, much anticipated, and I think we should get right into it. Is that enough of a roll call, or do you need? Okay, we're good.
Thank you.
Okay, reviewing the agenda. Somebody, John, you're not muted in case you didn't want to be. Any corrections or content or discussion of the previous minutes, and then a motion to approve. If anybody'd make a motion to approve in a second. I see a motion from Jeannie, a second from Krista. All in favor, raise your hand, say aye.
Aye.
Thank you. Okay, we're moving right along here. And if anybody has a concern, say nay or speak up, because I can't see everybody's face at the same time. Okay, we're going to launch right into it here. Equity work during the pandemic. And this is Suzuho Shimasaki, Deputy Director of Public Health, is on deck. And I think we have Bridger Trapp, Health Equity Intern, speaking about Protect Our Neighbors and Preventative Block Grant. Take it away, Suzuho.
All right, thanks, Greg. We can get the slide deck. Thanks, Lindsay and Abril. Appreciate you doing that. So we just wanted to take a little bit of time today to share some updates on the equity work that we've been doing. If we can flip to the next slide, please. I wanted to start with just celebrating a lot of what's been done over the last year. I know we've been focusing a lot on cases and vaccinations and haven't been able to really pause to highlight some of the equity work that's been going on with an amazing team of internal as well as external partners. And so I won't read through this full list, but just wanted to highlight a few of the big things to celebrate. You know, pre-COVID, we didn't even have any social media posts or accounts, just a basic website. And we now have an amazing website that's translated into Spanish, and all of our social media posts and communications, public health orders have been translated. We've done a lot of community meetings in Spanish as well as English, ensuring that a lot of our outreach efforts are done in a culturally appropriate way, hiring bilingual, bicultural staff as well. So just wanted to take some time to celebrate all of the big accomplishments that we've been able to make to help advance not just our COVID work around equity, but really continuing to push forward one of our core values of the public health department, which is equity and inclusivity as well. Next slide, please. So we'll talk through two of the big grant projects that we've been working on. The first one is the Protect Our Neighbor grant. Next slide, please. So you might remember that this project took place last fall. Just as a quick overview, there were two components to this grant: a planning grant that really focused on a needs assessment within our Hispanic Latinx community, as well as the implementation, which allowed us to address the various things that came up in our needs assessment. This work was strongly conducted in strong partnership with the Tri-County Hispanic Latinx Outreach and Engagement Coalition, which is a group that formed last June to really help move forward a lot of our equity work between Eagle, Garfield, and Pitkin County, not just the government agencies, but also some nonprofit and other health organizations that serve this 3-county area. And West Mountain Regional Health Alliance was a huge partner in this as well. So they've been contracted with us on both of the grants that we're talking through today to help bring in community members to help lead this work and ensure that all of the work for these projects are really led with by and for Hispanic Latinx community members. Next slide, please. A few of the methods or the process that we went through around that needs assessment was to interview or conduct focus groups with nearly 400 individuals who identified as Hispanic or Latinx across 14 different sub-communities within the Tri-County area. really having the 5 individuals that I listed on the previous slide help conduct these interviews and focus groups to hear from the community members. And then when we were analyzing the data, we were able to disaggregate it by different age groups or gender identities to see what similarities or differences there might be between adult women, adult men, youth, college students, and older adult populations. Next slide, please. And just to highlight a few of the findings, you'll see a list here of the different areas of people's lives that were greatly impacted by COVID. I don't think any of this will really be news to everyone here, but just wanted to highlight them as some of the findings from this grant, specifically with the disaggregated groups that I just mentioned. With Latinx women, we really heard that there was a lot of emotional and mental health impacts. For Latinx men, they were impacted more within the workforce, either not feeling like they had rights or were treated with respect from their employers who may not have supported masks usage or being able to social distance in the workplace and being fearful of their safety during their employment. For high school students, there's a lot of folks who shared that they had to take on jobs to help support their families, and similarly to the Latinx men, felt very unsafe in some of the work environments, which impacted their mental health, as well as the financial and economic strain that impacted their mental health as well. University students also talked a lot about increased anxiety and depression, symptoms that were resulting due to rapid changes in their learning environment and their living environment, which were unexpected and difficult for them to adapt to. And then for older adult populations, we really heard that they felt that their safety was in danger and they were struggling with a sense of isolation, not being able to spend time with family. So again, these are things that we've continued to talk about over the last several months, but just wanted to reiterate what we heard from the Hispanic Latinx community in particular as well through this needs assessment.
Nice, Suzuho.
Yeah.
Could you just describe, tell us a little bit about this great illustration you have on this page, if you can.
Yeah, to be honest, I can't.
Okay, no worries. We'll figure that out. I just think it's amazing.
I can find out for you though. One of the members of our team, Bertha, actually pulled the graphics for the slide.
Okay, wondering if it was local. All right, thank you.
Yeah, I'll find out. Thanks, Greg. Next slide, please. So again, we continued to dig a little bit deeper with the needs assessment to understand what resources people were familiar with to be able to help support them with the various needs that were voiced. And a lot of folks were not at the time familiar with options for testing or mental health resources, as well as employee support services. And so for the implementation part of this grant, we really focused a lot of the funds and the efforts around utilizing and partnering with these 3 modes of communication that were highlighted as the primary information centers who worked with the Hispanic Latinx community to be able to get some of that information out. So you may have heard some of our COVID prevention messaging that went out through the radio and TV. Next slide, please. And then these were some of the recommendations that came out. So we, in the implementation part of this grant, as well as the PBG grant that Bridger is going to talk about here shortly, we really try to take these recommendations that the community members shared with us about what we could be doing better to improve equity and increase access to various services and resources in our community to be able to best support them in the needs that were raised. Next slide, please. So specifically with the PON grant, we did send out a lot of COVID messaging around testing locations, when and why to get tested, things of that nature. And these are the different media outlets that we utilized. And then for the last slide, I just wanted to share some examples of those social media posts that we put out through our partnership with Ileana Renteria, who's been an amazing partner in really creating on her own this Facebook page designed in Spanish early on in the pandemic, and then helping all of the counties share out their messages as well. And then if we can click into that link, we can quickly just view one of the PSAs that were released last fall as well.
El coronavirus lo podría tener alguno de tus invitados a tu cena navideña. Hola, ¿qué tal? Los saluda el sargento Carlos Cornejo. ¿Sabías que incluso las personas conocidas pueden ser de riesgo para tus hijos? Mantén tus celebraciones solo con las personas que viven en tu hogar. Toma responsabilidad y protégete a ti para que así puedas proteger a tu familia. Usa tu tapabocas. Es un mensaje traído por el Departamento de Salud Pública del Condado de Pitkin.
Great, thank you.
So that just gives you an example of some of the PSAs that we were able to push out last fall. And I want to introduce everyone to Bridger Trapp, who is our health equity intern. He's just wrapping up his MPH practicum with us next Tuesday. It will be his last day. We're really sad to see him leave, but he's done some amazing work with our team and really having this community-driven approach. So he'll talk us through the protective block grant, which we received in March and goes through the end of September.
Good afternoon. My name is Bridger Trapp, pronouns are he, him, and I am wrapping up this MPH practicum experience. I had the privilege of serving as a health equity intern with Pitkin County Public Health this summer, and I was working under the preventative block grant, which came out of the results of the PON, and specifically acknowledging that while certainly there were a larger burden of challenges presented to the Latinx population in the Tri-County area due to COVID, a lot of those inequities and gaps in health equity existed prior to the pandemic. And so the goals of the preventative block grant were to minimize the impacts of and address these inequities that were exacerbated by the COVID pandemic, but also acknowledging that they were pre-existing. So the approach to that was supporting community members specifically with an access to community resources and specifically mental health services and awareness. That was a key finding that came out of PON, was a large lack of awareness of mental health services available within the Tri-County area that were accessible to members of the Latinx population. And then a key value of this grant was also minimizing gaps in equity with culturally and linguistically congruent services. And so to achieve these goals, if we go to the next slide, there's three main outputs. First is a community resource network that's being collaborated on with West Mountain Health Alliance and Pitkin County Public Health. This, through some of our contracted partners, collected a breadth of information about resources translated into Spanish and also specifically driven by Latinx community members to ask questions about accessibility relevant to members of the Latinx population. So this is going to be an online and a printed guide that will be used to help share and raise awareness of resources that exist, and is specifically catering to the community with language that's relevant to their populations, and also directly sharing information about potential barriers of access, including economic barriers, linguistic barriers, which services have bilingual or offer Spanish support, citizenship status, many relevant factors. And so also recognizing that a one-size-fits-all solution to an issue like mental health challenges does not equally offer benefit to different populations. This grant also is working on providing a Spanish mental health media campaign specifically designed and catered for this population. And so been working with a team we've put together of entirely bilingual and bicultural contributors to create a media campaign. And then there's also a health equity training plan that's going to both support Pitkin County and revising internal organizational practices to be more equitably focused, and also to support other organizational partners in the area considering applying this equity lens to their services. Next slide, please. So a key element of this type of work is this concept of partnership and a community-driven approach, recognizing that the expertise of how best to address these gaps in equity exists within the population we're hoping to support rather than within ourselves as an organization. So a lot of our key partners came from the Tri-County Hispanic Latinx Outreach and Engagement Coalition, the community advocate position of Mari Plaza Munet that was hired through the grant, and my ability to work as an intern to reach out and have conversations and bring in both internal and external partners that are bilingual and bicultural to support this process, strengthening those relationships and really emphasizing that providing spaces that allow these individuals to really shape and drive the campaign in a way that considers the needs of the population that they know and are a part of. So for example, we conducted the majority of our meetings entirely in Spanish, offering a space to think and design a campaign in a native language for that native language, rather than placing an expectation of shifting to English based on current norms. Next slide, please. And so for an example, to discuss a bit about the mental health media campaign that we're very excited about, we're finalizing some of the materials to provide. The community-driven approach led us to, these names here are some key partners that I wanted to highlight that became a core part of our strategic planning and marketing committee. Eliana Renteria, as I mentioned before, has been a huge help in really understanding how to best reach and share public health information with the population in this area. Maria Plaza, several members from Pitkin County Public Health, Rosa Salcedo, Berta Rivera, Abril Ramos, and Samuel Bernal, who is a radio host on the Tricolor, have been really key in shaping the direction of this campaign. And so that's come both from the messaging created and also the ways that this campaign has been allocated. There were only $10,000 allocated, and they decided to focus on radio and social media, specifically Facebook, as key ways of reaching this population, and specifically the priority demographics based on the results of the PONS. So adult men, radio as a key way to reach them, and adult women and stay-at-home mothers, adolescents and youth, and the elderly. So these were chosen, and they developed messaging, including this stoplight approach to promote awareness, reduce stigma around mental health, and to promote reaching out to find services. And so I'll wrap up since we've allotted our 15 minutes, but we're very excited that these radio ads on La Tricolor and interviews on Nueva Mix are going to be airing starting in August, and then on Eliana Renteria's Facebook page, which is seen by several thousand people within the community and the Latinx community. That'll be a source of further messaging related to these main goals of destigmatization, raising awareness. It will also be a way of offering warm handoffs to individuals asking for specific services to services in the community based on the collected resources that we put together in the Community Resource Network. So we're very excited for this. And again, I want to highlight that this campaign has only been possible because of the very motivated and enthusiastic and passionate bilingual and bicultural members who saw the opportunity to use this grant as a way to really affect positive change in their own community. Thank you.
Bridger, thank you. And Suzuho, I just wanted to say, I only know two people on this list, Ileana and Samuel, and they have got such a great history in our community. So thank you for calling them up, and hopefully we'll get a chance to meet all these people. And Bridger, great to meet you. Fantastic work. Thank you for being here, and sorry to see you go.
Thanks, Greg. Yeah, we've had an amazing group of probably close to 30 people actually between our coalition and then some of our smaller work group members, and would love to build connections anytime there's an opportunity to do so. So with that, we can open up for questions. I do think we have till 1:20, so if we don't have questions, Bridger, you could go over your last slide too. He just has a few more examples of some of the messages that we're sharing out there, but happy to take any questions if folks have any for either of the projects we're working on.
Well, if somebody has a question, raise your hand or speak up, and we'll recognize you. Just wanted to say, Ileana and I think we took mental health first aid together, or perhaps she was already a teacher by the time I took it. But she's been around since I first came on with in doing mental health sort of activities, and she's just been a ray of sunshine. And so it's good to see her here, and Samuel as well has been a great partner. So for all of us. Thank you. Any questions? It looks, I don't see any here. Let's keep moving if we can. We're going to keep going, and we can always pick up more questions later if something occurs to you all. Thanks again, Bridger.
Great, well, I think I'm up. So we also-
sorry, Josh Vance, sorry, I didn't introduce you. I apologize.
Yeah.
And I also wanted to thank our alternates for being here today. So I'm catching up here. Thanks, Josh.
Yeah, no problem, Greg. So we have also been working on what we're calling the long haul COVID-19 study here within Pickens County. And so this is a study that really took place several months ago. And a lot of the data that was collected was back between November and March of this past year. But if you go to the next slide, please, I can sort of preface what the study was about and what we were looking at. Long haul COVID are essentially symptoms or conditions that persist or develop following the acute phase of COVID-19. Many people develop symptoms and they're sick for several days when they are first infected with COVID. Many go on to recover, and that's sort of it. Many more individuals go on to develop symptoms or conditions that are related back to their initial COVID infection. And so this is termed as long haul COVID. There's a lot of other terms for it as well: long-term COVID, post-acute sequela of COVID-19, post-COVID syndrome. A lot of different names for essentially all the same thing. I'm looking at these conditions that are developing or persisting several weeks or months following infection. Next slide. There are many studies on this right now that are ongoing and have already been made available. Current studies estimate that somewhere probably between 10 and 40% of individuals that have had COVID-19 will experience at least one new symptom or condition following COVID-19 infection. Some individuals will have much more severe disease. Some are going to have, much more severe conditions or symptoms. Some will have less severe. Just really, there's a lot of factors that play into it that really predict, whether or not you'll be someone that develops more severe or less severe symptoms or conditions. Some individuals with long haul were actually asymptomatic during their initial infection, so they reported no symptoms, but then several weeks or months later actually developed some conditions that were consistent with long haul COVID. And then the other important thing to note is that sequela, or these symptoms or conditions, do differ among people that were hospitalized. They differ among individuals of different ages, pre-existing health conditions, and so forth. And so, as we look at the data, there are disparities in different groups of people as we look at it. And then, many studies find different results depending on who they're sampling, when they did the sampling, which symptoms were asked about, et cetera. So that's why there's a really large range here. When you look at the different studies, it's really hard to narrow it down and pinpoint exactly how you're defining post-acute sequela or long haul COVID. Next slide. This is one study that I just wanted to highlight before jumping into ours, just to show you kind of what other studies are looking at. And so they compared individuals that were hospitalized to those who were not hospitalized but still tested positive for COVID, and they interviewed them 6 months after their infection. And this essentially shows what they found. And so individuals that were just testing positive, you can see that green bar there shows what the different types of symptoms or conditions they developed were compared to individuals that did not test positive. And then in the orange and then the purple, you can see individuals that were hospitalized or those who were in the ICU. Again, you see a much larger disparity among the different sorts of conditions that are developing among individuals that were hospitalized or in the ICU. And so there does appear to be a severity component related to long haul COVID, in that, more severe acute infection does tend to be associated with more or more severe symptoms or conditions later on.
Hey, Josh, can you just explain the charts? What are the scales indicating? I'm not sure I understand that, or what the dotted line is, just to give a reference. But the point is taken.
Sure, Greg. So they're called adjusted hazard ratios, and essentially you're just comparing the two groups and you're finding, what's the likelihood that an individual in this group would experience this condition. So when you look at acute coronary disease, for example, look at individuals that are in the ICU compared to those who were not in the ICU. Individuals in the ICU were at a much greater likelihood of going on to develop acute coronary disease than those who were not in the ICU. So the scale is over here. I was trying to cut it down to fit it onto the slide. But essentially they're just ratios of the number of individuals that are experiencing that condition compared to those who did not.
And is there an obvious takeaway for the lay people like me from this?
Yeah, I think the takeaway here is that individuals that were hospitalized or in the ICU in this report tended to experience many more symptoms or more severe symptoms following their COVID-19 infection several months out.
Great, thank you.
Yep. Next slide. So our study here, what we did is we developed a questionnaire back in August 2020 to assess the current and future needs of our community members with regard to what we're coining long-term effects of COVID-19, long haul COVID. And so our team conducted telephone interviews anywhere between 6 and 7 months after diagnosis with COVID-19. And so any new condition that an individual did not have prior to their diagnosis with COVID-19 and had experienced at the time that we interviewed them, we counted that as having been a sequela or a symptom or a condition. So in other words, we called individuals, we had a list of 67 different symptoms or conditions that we were asking about. And we asked them, are you experiencing, these different symptoms? And they went through the list one by one. Individual would say, yes, I do have hair loss, for example. And then the question was, did you experience hair loss prior to having COVID-19, or is this something that has come on since having COVID-19? If it's something that they had prior to COVID-19, we didn't consider it. We only considered things that had developed after their infection. And so we ended up interviewing 103 individuals, which was a 68% response rate. We attempted close to 157 total interviews. And these were just every single individual that was reported to us from March to August 2020. We had 157 infections. We tried to call all of them, and we only got a hold of 103 of them, which is still a fairly acceptable response rate. We only included Pickens County residents at the time of both their acute illness when they were originally diagnosed with COVID, and then they had to be a Pickens County resident during the follow-up interview 6 months after, and they had to have tested with a PCR or with someone who was epi-linked. And an epi-link is someone that was exposed to somebody who tested positive but didn't get a test themselves. And so we did have 5 patients that we excluded from the study, 2 individuals that had died during acute illness, and then 3 individuals that had moved out of the county. Otherwise, everyone else was included in our findings. Next slide. And so this chart here, what it does is it looks at the total number of long-term effects that individuals reported to us. Again, there were 67 that we read. So the maximum on the x-axis would be 67. And you can see here that we had 1 individual report 36, and then you have a smattering in the middle there. We had about 42% that reported 0 long-term effects. So we called them and they said, I have nothing. There's nothing new. But then we had about 59% of individuals that had at least 1 new symptom or condition that had developed after having COVID-19. And this is a much larger number than anticipated, right? I shared a few slides ago that most studies are, seeing 10 to 40%. We had 59% of the individuals that we interviewed. Of course, there are a lot of, potential confounding factors in there that may have, increased or decreased that rate. But regardless, the point is that, you can just see just in the individuals that we interviewed, there's just a wide range of individuals experiencing a lot of different effects from COVID-19. And again, this is 6 months after their infection. And so just, quite a few individuals that were still very heavily impacted from their infection. Next slide. So then on the next few slides, just want to break it down by a few different demographics here real quick, just so you can kind of get an idea of what we were looking at. So if you look at age, what this graph here is showing you is the percent of individuals that made a medical visit between having their initial diagnosis with COVID and the 6 months when we interviewed them. So looking at that 6-month time frame, did somebody make a medical visit for their symptoms that they were experiencing? And interestingly enough, individuals younger than 40, 32% of them had made a medical visit to a doctor to say, I'm concerned about what I'm experiencing in these symptoms or conditions. And you can see that there is a trending downward. Some other studies also support this, that younger individuals were making more medical visits and actually more likely to report long-term effects. So that's what you can see in the blue bar there. That's the percent of individuals in that age group that reported at least one long-term effect. And again, there's that trending downward as you get older. And so, as I mentioned, there are studies that support that, and it's not exactly clear why. But that's what our findings suggested in terms of age. Next slide. Ethnicity was the same idea. Hispanics were much more likely to report having at least one long-term effect, and they were also more likely to make a medical visit. I do want to emphasize that we didn't have too many Hispanics that participated in the study, but regardless, I think the picture here is clear in that Hispanics were more heavily impacted by, or have been and probably currently are still more impacted by long haul COVID. Next slide. Income level was the same idea. Individuals that reported less income were far more likely to report at least one long-term effect. You can see 78% of individuals making less than 50K, that's the annual income level per household, they were much more likely to report long-term, or at least one long-term effect, than those who are making more than 50K. In terms of hospital visits, it was pretty similar, and we know that part of that is due to barriers to accessing healthcare. Next slide. Insurance status. So sort of the same idea here. Uninsured individuals much more likely to report long-term effects, but less likely to make a medical visit, likely due to not having insurance. Next slide, please. And then these are just the most commonly reported sequelae that were experienced by all of our study participants. So fatigue, post-exertional malaise, essentially feeling sick or off after you've worked out or exercised, shortness of breath, impaired smell, and then the list goes on. And so there's a very wide range of symptoms or conditions that were reported by individuals in this study. A few that I want to point out that are interesting is ringing in the ears. We had a few individuals that even reported that they had lost hearing in at least one ear. And so, that was obviously a concerning thing that did not seem to be just due to chance alone or just coincidental. Hair loss, things like impaired taste and impaired smell were something that individuals continued to experience after their infection. Phantom smell, we had several individuals reporting that they just, like the garbage smells like cotton candy, and just really different, interesting different things that people were experiencing. Confusion, lots of symptoms, as I mentioned. And so there's really not a one size fits all for individuals that are experiencing long haul COVID. There's really a lot of different symptoms that individuals were experiencing in our study. Next slide.
Great. Thanks, Josh. We're kind of starting to run behind time here. I don't know how much more you've got.
I'm done. This is it.
Great.
I just wanted to just briefly highlight yeah.
Great. Thank you so much. Thanks and everybody can refer back to those slides. That's fascinating and valuable information. We've got shifting roles and responsibilities from Jordana coming up.
I think it's still Josh, just to cover a little bit. Yep,
okay.
About the roles of the DI team and how that's been changing a little bit.
Okay, thank you.
Yeah, if you can advance, I think 2 slides. Yep, one more, please. Yeah, so currently we have 5 full-time case investigators and contact tracers. And so I don't need to go over what their roles are. Usually, I think that's pretty clear at this point. But we do have our case investigators and contact tracers participating in other duties, especially when incidence is low. And we don't have as much DI related work, which has not been the case recently, of course. But when there are those lulls, our DI team is also supporting the vaccine street team. So they're out on the street supporting that team. They're attending vaccine clinics. They're working the vaccine hotline, conducting outreach to our businesses, and they're also investigating other non-COVID reportable diseases as well as many other things. And we do have 4 team members that support our contact tracing team on a voluntary basis when we have a surge in cases. But just wanted to emphasize that, our contact tracers are staying very busy, whether it's doing actual contact tracing or whether or not they're supporting our vaccine team or other departments within the county. So next slide. Okay, and I think I'll just hop into the update. Next slide, please. So this is our current incidence and case counts. I did use the CDC's new threshold levels here to show you where we're at in comparison to what the CDC deemed high levels of community transmission. And you can see with the purple line, our 7-day instance has really been floating between about 150 and 200 for the last several weeks, which is an instance labeled as high by the CDC. Anything over 100 CDC labels as a high incidence. And so we've really just been hovering and sort of floating in that area for quite a bit. Next slide. So this is where we stand in comparison to other counties across the state. You can see that there are many counties within Colorado that are reporting very high incidence, again, over 100 cases per 100K. In comparison to some of our neighboring counties, our incidence as of last night was 135.2, changed a little bit as of this morning. Eagle is up to close to 200, and Summit County is up right around 316. You can see Mesa County, after their increase in surge the last 2 months, their case counts are coming down a bit, but still fairly elevated. Next slide. And so one thing I really want to emphasize during this presentation is breakthrough cases. This is something that's been in the news quite a bit. A breakthrough case is an individual that has been fully vaccinated, but then tests positive for COVID. And so we knew that we would get a significant amount of breakthrough cases, just given the fact that the vaccines aren't perfect. And so John Anderson, our data analyst, and I have been closely monitoring this data and trying to assess where our levels are in comparison to where they should be. And really, based on some formulas that we've used, the breakthrough rate is a lot higher than expected. And so in the past 28 days, 66% of all of our cases have been vaccine breakthrough cases. Based on some formulas that I mentioned a second ago, we estimate that it should be closer to 25 to 30% of cases being breakthrough. And I think what this emphasizes, on the next slide, please, is several different things. And there's many different explanations for why we're seeing such a high rate breakthrough in the county. One is certainly a waning of our vaccines, or the vaccines becoming less effective due to Delta variant. There's a recent preprint from the other day that did find that there is a significant reduction in efficacy of at least preventing symptomatic infection. Again, vaccines have still done an incredibly amazing job at preventing hospitalization and death overall. But in terms of preventing symptomatic infection, they were never really designed to do that. And so we're seeing the effects of that, that more people are developing symptoms and testing positive for COVID, even though they were vaccinated. Some other reasons why our breakthrough cases, our rates may be higher, is that our vaccination rates are actually higher than projected. For example, we had residents vaccinated elsewhere and are not included in our counts. So that could certainly play a role. Testing behaviors may be different between vaccinated and unvaccinated people. And so we may just be having more people that are vaccinated getting tested. And so that could be playing a role in why we're seeing this. Fully vaccinated people might be participating in more high risk activities than unvaccinated individuals. But then the other piece is, our high vaccination rate it gets diluted when there is a lower rate of individuals that are visiting or coming to the county that are not vaccinated, which I'm going to touch on in a few slides here. But really, there's this dilution of our vaccination rate, whereas we're about 75% fully vaccinated. If you bring in 20,000 individuals, significantly lower vaccination rate, we dilute it, and it creates a greater risk pool for our county residents. Next slide. So to emphasize that first point in regards to vaccine waning, of course, there are studies coming out looking at this, but this is our local data here. And the blue bars here show the number of individuals that are a vaccine breakthrough case. by the month that they received their final dose. So for example, if you look at January, we had 10 individuals that had been a breakthrough case, and they received their final dose in January. The black line is showing you the rate of breakthrough cases by month. So it's taking the number of breakthrough cases and it's dividing that by the total number that were vaccinated that month, and it's giving you a rate. And the rate is what's important to look at here, because it indicates whether or not we're seeing any sort of waning in our vaccine. And the data does suggest that individuals that were vaccinated earlier on, January, February, are likely less protected at this point than individuals that were more recently vaccinated. And so, this is an important piece to discuss, especially in light of FDA, being expected and to approve booster doses, in the next few weeks. And so, I think this data from other counties, from other states, is really emphasizing the need for those booster doses, because we are seeing that antibodies do tend to be waning over the months. Next slide. And then other thing I wanted to emphasize with the last point I made about our vaccination rate being diluted is that we have had a significant increase in the proportion of our cases that are due to visitors. And so about 38% of all of our cases in the past 14 days have been a visitor. And we do know that we miss some of the cases, so we don't always get all the cases reported to us among visitors. And so it could be slightly higher. It's at least 38%. And so, again, this rate has remained very consistent for the past month, where we've just seen a very high rate of visitors who are here in Pickens County and testing positive. Next slide. And so to underscore that point, we do still interview all of our visitor cases as well as our resident cases. And what we found is that, again, our resident cases over the past 28 days, 66% were vaccinated compared to only 34% unvaccinated. If you look at our visitor cases, there is they are much less likely to be fully vaccinated than our residents. And so, the visitor cases more so mirror what we're seeing nationwide, whereas our resident cases more so mirror our vaccination rates here locally. But again, this underscores the fact that, we're seeing this dilution of our vaccination rate when individuals are coming here and they are not fully vaccinated. Next slide. And so last thing I want to emphasize is, we do have cases coming from many different places. So, it's easy to blame our, visitation on, certain states or different jurisdictions, but really it's individuals coming from all over the country. And so, this rainbow graph here really just emphasizes where our different cases have been coming from in terms of our visitors. Not all of our visitors were exposed before they arrived. So it's not that they're all just showing up here having been exposed back in their home state. We do have some who get here and then they're exposed here in Pickens County. And so I do want to make that point clear as well. But I think the point here really is, obviously we're a tourist community and we thrive off tourists, and would in no way want to disincentivize people from visiting Pickens County. But I think, we have done such a good job in our county ensuring that our residents have access to the vaccine. And we have such high rates of vaccination that, we really want visitors who are coming here to be fully vaccinated to ensure that we're keeping our community safe when arriving. So anyway, those are my slides, and that's my update. And I'll pass it off to whoever's next.
Thanks, Josh. And I just want to confirm that even though we are seeing a number of breakthrough cases here for those who have been fully vaccinated, the case rates, incidence rates for those that are unvaccinated continues to be higher than for those that are vaccinated. So vaccines continue to provide more protection than not being vaccinated, and continue to be a very good option for helping to control the spread there. And with that, I can go into our vaccination update as well. So currently 81% of the total population of Pickens County has had at least one dose of vaccine. I wanted to share a little bit more about what's been going on since we have transitioned from the mass vax clinics in March or through March into these smaller pop-up and mobile community clinics. We have, since the very end of April, mostly May, into June and July, have had weekly clinical appointments at community health services, and have been focusing on Pfizer, Johnson & Johnson, since other providers do have the Moderna. We've, in these past few months, administered over 1,200 doses. You can see the breakdown here in the slides of what's been administered, and have really had a very high rate of return for the second doses. The demographics, some snapshots of who we have been vaccinating. 33% have self-identified as Latinx. 12 to 18-year-olds have been 39% of those vaccinated. 18 to 30-year-olds, 18%. 30 to 50-year-olds, 31%, and those over 50 have been about 12% of those that we vaccinated beginning in May. The gender split is fairly even. And on the next slide, we'll just take a minute to discuss our current efforts. So we are working to bring more medical providers online. The goal is we've got 5 who have expressed interest, and Pickens County Public Health and Community Health Services have been in touch to provide support if those providers need support in understanding how to do this in a clinic setting. We really think that this is going to be imperative to meet the potential need for younger patients, to be able to do that in pediatric and primary care offices, as well as those with unique medical circumstances, and those who need additional guidance. As Josh mentioned, boosters are expected to be approved within by Friday. They're saying there's a meeting that's occurring, and we're really preparing messaging and a process to be able to figure out how we can help support that new expected recommendation of those individuals who are immunocompromised being recommended for a booster dose. Community clinics that are happening in August. Just wanted to share that we do have a clinic coming up next Wednesday, August 18th at Aspen Middle School from 10 a.m. to 2 p.m. This is a clinic that's open to anyone in the community, but it's great for those who are thinking about needing to get vaccinated, going back to school, whether you've got a school child or it's open to parents, coaches, staff, and the rest of the community to be able to get vaccinated at the Aspen Middle School next week. We also have a vaccination clinic at the Snowmass Center on August 20th, which is Friday, from 11 to 2:30. And then August 24th, an early morning clinic from 7:30 to 10:30 a.m. at Wagner Park in Aspen. So we are continuing to offer these pop-up clinics, especially through the end of August. This is the schedule that we've outlined. We'll continue to work with community partners to host targeted clinics as we come into the fall and winter, especially for newly eligible students. It's looking like in children under 12, we'll be getting some guidance there to be able to be vaccinated coming in the winter, possibly as early as December. Incoming winter employees who might be coming back to the community, or those at-risk or hesitant populations who haven't been vaccinated. That is a need that our Pickens County Public Health Department can continue to meet with these community clinics. And otherwise, we're really excited for more of our community providers to be able to have the opportunity to vaccinate people in their practices where their patients are already coming, where folks can get the medical advice of their doctors. Additionally, we've already worked with Aspen School District to find that day. Aspen Country Day School will have a clinic there. Ski Cove, Viceroy, some religious centers. So that work continues. The next slide, please. This is just a snapshot through the beginning of August. of the vaccines that we have been providing in Pickens County at those clinics. You'll notice we've been declining since the larger clinics in May to these smaller clinics around 50, 75 doses that have been given. And then you'll notice these smaller Pfizer doses in red. Those are the clinics that are happening at community health services. So right now, if you can call up community health services and request an appointment to get vaccinated with the COVID vaccine and find a time that works for your schedule. So that is something that is continually offered as well. Next slide, please. And I'll turn it over, if it's all right, Greg, to John Anderson for the next update.
Yes, great. Take it away, John.
Hi, everybody. Good afternoon. My name is John Anderson. I'm the COVID-19 public health analyst. I just want to take a few minutes to walk you through some of our website and dashboard updates that kind of touch on a lot of the issues that Jordana and Josh kind of highlighted in their presentations. So I'm going to go ahead and share my screen real quick. All right, I think that's, can everybody see that?
Yes.
Okay, so this is our COVID-19 Pickens County homepage. We've adopted the CDC community transmission metric as our determination for our risk level here, and we're posting that on our homepage, as well as on our COVID-19 status page, where we go into a lot more detail about what our risk level is, what each of those levels mean. A lot of these are just taken from the CDC language. And then we've kind of outlining how we're using this this metric in our mainly driving our healthy best practices and mask recommendations. And the advantage of doing this is, providing more consistency with many places across the country. Here's a picture of here's the CDC website that shows these county level determinations for our whole country. So I think one advantage of moving to this is, residents and visitors alike will understand, hopefully understand more about, how this is determined, presuming where they come from, they can also use the same metric. We've also posted blog posts for these
Hey, John,
changes. Yep.
Excuse me just for a sec. Just had a question about that chart, that last chart. Colorado was red and everything else was a lighter color. That's we're just highlighting Colorado here. Is that correct?
Yeah, I was just selecting Pickens County.
Okay, just wanted to make sure.
Yeah.
Thank you. Because when I
Sure, no
saw that,
problem.
I thought, oh, great. That doesn't give me the message, but now I understand. Okay.
Yeah, and so, but just to be even more clear, yeah, this is how this is being determined is this this determination here. And there's primarily two metrics that are driving this. It's the 7-day incident rate and 7-day % positivity. And then the CDC automatically selects the highest of those metrics if they're different or in a different level. And like I said, we've got this blog post that we released the other day just to kind of explain these changes to everyone. These links are all available in the PowerPoint as well. And then let me click on over, let's see, to, this is our case and testing data dashboard. So we've added some data.
John, we're not seeing your screen anymore.
Ooh. There we go. Sorry about that. This is our case and testing data dashboard. And I just want to highlight a few pieces of information, particularly related to the breakthrough cases that Josh and Jordana were speaking to. So we've added this overall scorecard, which has our total number of cases among fully vaccinated people, or breakthrough cases. This is the total since January 1st, basically, when we were really starting to vaccinate people. And then we've got a percentage of those fully vaccinated residents since April 1st. And the reason for choosing April 1st is just that's about the time we estimate 50% of our population was fully vaccinated. So trying to keep this percentage as accurate as possible and not throw a bunch of cases where we had low numbers of people who are vaccinated. So this gives you an idea. Since that time, we've had 0.6% of our cases among fully vaccinated residents. And then as another way of highlighting, this is what Jordana mentioned about incidence rates. We've also added this cool filter so you can filter down to some of these dates. So I'm going to go ahead and do that. So this is looking at our incidence rates among our unvaccinated population and our vaccinated population. And you can see what Jordana was highlighting, the cases among the incidence rate among unvaccinated for the last 28 days has been about 1.5 to 2 times higher than the incident rate of among our fully vaccinated population. And then another piece that we've added here is just a weekly count of our variants. So people can kind of see how the ratio of variants is breaking down more recently. There is a lag in this data because of after a PCR test is positive, it gets sent away to a lab. There is about I think a 1 to 3 week kind of delay in getting this result. So these kind of trickle in over time, but we are starting to see a little more Delta variant in the last few weeks here. And we've also kind of added a broader level case count by calendar week, just to kind of give people another kind of perspective, maybe easier to think of perspective about week to week, what are we seeing in our county. Of course, if anyone has questions about this or any of the data or websites, there are these 2 links down here you can click and ask questions, and myself or somebody else will respond. And also we did, I guess about 2 weeks ago, when we made these changes, we did push out this blog post to, again, try to explain all this information, why it's important, and sort of how it's being calculated and presented. So I think with that, I'll stop there and see if there's any questions.
Great. Looking for questions. If not, we're going to keep moving here. We're doing pretty well with schedule. Just soon keep moving. And once again, speak up if you have a question. Thank you. Jordana, why don't we keep going here?
Sounds good. Thanks, Greg. So I'll be talking about school and childcare guidance recommendations and requirements. Next slide, please. So since school had got out back in May, we've been meeting with school and childcare partners to really be planning for what should guidance look like for the next school year, which we are about to be starting now. And we were able to agree with this group on a number of goals. Our goals in developing the guidance is really to keep kids and staff in school to the greatest extent possible, to prevent transmission of COVID-19 within the school and childcare setting, and then also to create a learning environment where everyone feels both emotionally and physically safe. Next slide, please. I think we discussed this at our last meeting, and Greg really brought it to the attention that the U.S. News and World Report ranked Pickett County the 7th healthiest community in the United States. We've got
a muting issue or something here. We got feedback, huh?
Thanks for muting, Dr. Kurt. Of the top 25 healthiest communities in the report, Pickett County had the lowest death rate during the COVID pandemic. And so we really wanted to recognize that we've been working in partnership with community leaders to take the appropriate preventive measures and have felt that it's proved protective for our community. And this is really the mindset and framework that we enter into a lot of these discussions and how we approach policy setting. Next slide,
Jordana, if we could, this would be an opportunity just to thank the community for going along and doing the job that they've done. And that includes you, the Board of Health, and our medical community, and the entire community at large. I think we've done quite well, and this indicates it, this survey. So kudos to everybody involved, and in that spirit, let's keep going. Thanks.
So now dropping down into the guidance. So the CDC has outlined guidance for getting back to school that really starts with promoting vaccination. We know vaccination is the leading public health prevention strategy. And as we've shared, we're continuing to work with our school partners to promote that. And we've got some of our school partners who will be speaking after I talk and can give some more details about how other efforts they're taking to promote vaccination as well. Consistent and correct mask use. Given that the new evidence on the Delta variant, CDC came out and did update their guidance for fully vaccinated people with recommending when there is higher substantial transmission and risk to be wearing masks indoors. And they also came out and recommended universal indoor masking for all teachers, staff, students, and visitors to K-12 schools, regardless of vaccination status. Really citing that children should return to full in-person learning in the fall with these layered prevention strategies in place, and knowing that vaccination and mask use are two of those top prevention strategies that we know are effective. In general, people do not need to wear masks outdoors is the most up-to-date guidance from the CDC. Physical distancing continues to be important, and the guidance is really around being able to do that as much as is possible. It's more important to have students in the in-person learning environment than to just keep the distancing requirement, which led to some of the hybrid schooling that we saw happen last year. And so going forward, the guidance has really come to, when it's feasible, maintain at least 3 feet of distance within the classroom. When it's not possible, use those other prevention strategies like masking, screening, and testing to keep kids and staff safe. Next slide, please. Other prevention strategies can include screening programs, improving ventilation, hand washing and respiratory etiquette, staying home when sick and getting tested if you have any symptoms, contact tracing being used in combination with isolation and quarantine when appropriate, and cleaning and disinfecting, and the guidance is really once a day is sufficient. So the overall CDC recommendation is for localities to monitor community transmission, vaccination coverage, screening, testing, and occurrence of outbreaks to guide decisions on the level of layered prevention strategies that should be implemented locally. Next slide, please. The key points in the Cd Phe guidance, so this is then our state guidance, is to emphasize those population-based strategies and layered precautionary measures. It's really framed as a guide to operationalize the CDC guidance, so it aligns with the CDC guidance that exists. It continues to state that vaccination is our best defense against COVID, and continues to support the isolation of positive cases, contact tracing, and quarantine, dependent on the population protective factors and risk of exposure. To continue infection prevention strategies, just like the CDC outlines, hand washing, routine cleaning, good ventilation, staying home when sick, and then encouraging activities outdoors when the weather permits. The Cd Phe also goes into low and high risk exposures and how those may be treated differently. Next slide, please. Finally, the American Academy of Pediatrics has come out with guidance. Last year, they were really responsible for advocating for in-person learning, but did acknowledge that where the virus was widespread in many schools, that there would be the need to adopt virtual lessons. And in this year, for the 2021-22 school year, the American Academy of Pediatrics has been advocating for in-person learning again, and with universal masking for all students over the age of 2 and staff, regardless of vaccination status. Just on August 10th, the American Academy of Pediatrics Colorado chapter drafted a letter to Cd Phe, to our state. And here's just one line out of it, was that on behalf of our nearly 800 pediatric members statewide across Colorado, we urge you to act now in the best interest of the young people in our state by requiring universal masking in all Colorado schools and childcare settings. Next slide, please. So when we're thinking about Pickens County, these are the specific considerations that the CDC has outlined that we should be taking into account. The first is the level of community transmission. As Josh shared, we currently have high community transmission with over 140 per 100,000 over a 7-day period. We should consider our COVID-19 vaccination coverage rate. So we know across the county, 62% of Pickens County residents are fully vaccinated. 65% of 12 to 17-year-olds are fully vaccinated, and that number just keeps ticking up every time I update these slides. It's great to see that number continuing to tick up very quickly. And 0% of our 0 to 11-year-olds are fully vaccinated because they haven't had that opportunity yet. So that's our coverage rate of those that are residents. And I think for us to consider, what we also know is that we see transmission in our community is very affected by the visitors that we have, the vaccination rate among visitors, the activities that are involved in. And so when we take into account recommendations and policy, just knowing that just having our population, resident population be vaccinated is not the complete picture, that we really need to consider all of the different influences and impacts in our community. The third consideration is the use of a screening testing program. And we're really recommending this for higher risk situations, and thinking about the turnaround time is really important when doing a screening program. We've had some learnings from the screening programs that have been implemented with the school in past years as well. So COVID outbreaks should be a consideration. So fortunately, this summer, we had no outbreaks at summer camps or childcare facilities. But mask adherence was high when children and staff were indoors. And over the summer, up until we saw on the chart, up until just after July 4th, prevalence of COVID-19 was low for the beginning part of the summer. Delta variant, now it's the predominant variant. We just saw in Colorado, the last updated status is that 100% of positive COVID tests that have been sequenced are Delta variant. We know that this variant is more transmissible, and likely there's an increased risk of hospitalization with the Delta variant. We also know that many children's hospitals across the country are seeing an increase in hospitalization among children, which has been worse across the country in some of these places than any point in the pandemic thus far. So just taking this into consideration as well. Next slide, please. School and childcare recommendations. So what are we recommending? First of all, absolutely promoting vaccination for eligible students, staff, and families. Again, a reminder of the Vaccination Clinic at the schools next Wednesday. Continue infection prevention strategies. These are the things that we know are easy to do, have been in place beforehand, and continue to be helpful. Hand washing, routine cleaning, good ventilation, and encouraging activities outside when possible. Staying home when you're sick, regardless of your vaccination status, and testing to return. This is extremely important to reduce transmission in the school setting and in the community. This has been our guidance all along. Screen for those symptoms and stay home when you are sick. A screening testing program. Again, we're really recommending this use for the higher risk situations, and have been working with our school partners on what this can look like. Physical distancing, we continue to recommend that we implement this to the extent possible. And transportation, masking is required on on buses and transportation per federal law. And that's again for everyone, regardless of vaccination status. And isolation. We'll continue to isolate positive cases of COVID. as indicated and as we've been doing throughout the pandemic. Next slide, please. So the other recommendation that aligns with the CDC and American Academy of Pediatrics is that we do recommend requiring universal masking indoors to limit the need to identify contacts or quarantine for classroom exposures. So this is a very exciting slide. As we came to learn last year, some of the biggest interruptions to school were the quarantines. If we had last year, even though kids were masked in the classroom, we were still identifying a case, and then any close contacts were required to quarantine, resulting in interrupted learning for a large number of children. And so our primary goal in starting this year was, again, keeping kids and staff in school as much as possible. And one major way to do that is to reduce the necessity of quarantine, which we have plenty of data now to illustrate that when that's happening in a masked setting, that can be done safely. So we're really excited about this piece, as is many of our school partners. So what we know is that schools with the universal masking policies experience an extremely low secondary transmission rate, about 1 to 4%, as compared to schools without masking, who saw 11 to 27% secondary transmission rate. For children under 12 and those who are unable to be vaccinated, we know that masks are the safest and most effective tool at reducing the spread of COVID-19. So that's the mask point. Additionally, for consideration, we've indicated that if a school can reach 70% or higher fully vaccinated among students, staff, in the building, we could consider that building or facility be mask-free. Still with a no quarantine option if the incidence is below those 50 cumulative cases per 100,000 population in the past 7 days. So that is something that is drawing on the data of what we know in very highly vaccinated populations, and also knowing that starting the school off fully masked, we are going to have some different examples of different policies throughout the state that will be able to evaluate school cases and transmission in other school districts and adjust as necessary. The final point here is that quarantine or testing are really tools that we're using for these higher risk exposures, and especially quarantine is no longer our first go-to control strategy, as it was for the majority of the year last year. Our next slide, please, shows that these are just some of the guidance that we're still continuing to work through with our school and childcare partners. So additional guidance for some of these higher risk sports, additional guidance for cafeteria and lunchroom when we know masks are going to be off. How do we put policies and procedures in place so that if there is an exposure in those settings, it doesn't have to lead to quarantine, which is what we're really striving for. And then also those higher risk settings of band, orchestra, and choir where there's forced exhalations. Next slide shows really the question for discussion to the Board of Health today is to discuss the staff recommendation that there be a requirement for universal masking in all school and child care settings effective August 18th. And then we also have this consideration of if at least 70% of the total population at the facility or entity are fully vaccinated, and the incidence rate is low or moderate, then the facility or the entity, if they've consulted with public health, that they can be exempt from the masking requirement as long as those conditions above continue to be met. So with that, the next slide brings us, Greg, to our school and childcare partners who have joined us on the line.
Great. So there, David Baugh, Brian Davies, Robin Strecker are online and ready to join us.
And we also have Michael Hayes.
And Michael Hayes, I see also on my agenda, but not on this page. But thank you, Michael. Thank you all for joining us, and please carry on. You know, while you're teeing this up, Jordana, I just wanted to say, looking at that presentation, the thing that strikes me is that we don't really talk about the cost of what happens when you're not masked, when you're not taking the most precautions. Things get very expensive if you have to quarantine or shut down or go to teleconferencing or take the drastic measures that we've had to take in the past year. So I think there's an economic component here, which maybe we can discuss sometime in the future. But thank you for that. And I'll let you take it away. Is David up first? David Baugh?
I'm ready to go if that works for the board.
Please do, sir, and carry on. Thanks for being here.
Great. Thank you for having us. I want to thank Jordana and Pickens County Health for their phenomenal help through this difficult time. And as we're entering year 3 of education in the global pandemic, I want to just briefly birdwalk and point out, Greg, that your point about a cost is very, very accurate. And there's a real cost to kids when they're not in school, and a real cost to families as well. So when kids get sick, when kids have to quarantine, it's really hard. And there's a real cost to lost learning. And, you know, I'm sure you've seen stuff in the news about that as well. If I may, I'd like to share an email from a staff member that I got earlier this week, unsolicited. And basically it said, I'd like to advocate for a mask mandate for our students and staff when we return for school this year. I feel that it gives our district the best chance to serve our students' educational and emotional needs. It will keep our community healthier and safer and allow us to teach in less interrupted environments, which for me was the key to our success last year. This person was tasked with serving the emotional needs of some of our youngest students. I collected data last year around our student thoughts on COVID as well. The overwhelming majority of students felt okay coming into school because of the precautions we put in place. And working with Pickens County Health, we continue to pursue the layered mitigation efforts. So our students' biggest frustration and fear was around doing virtual learning and going through quarantines. The masks were rarely brought up as a source of emotional distress. I did not hear of one student or family who chose to not send their kids to school because of masks. On the other hand, we did have lots of students and families that chose to attend in-person learning because we had the mask wearing. Our elementary kids adapted incredibly well to the new rules and standards last year because they knew it increased safety. It promotes kindness and thinking of others. If we have masks mandated, we will not only have a more productive school year, but we will once again be a pioneer in the balance of how to operate a school environment for all students. As an employee who works primarily with the population that cannot get vaccinated yet, I would feel more comfortable coming in every day if there was a mask mandate. This should not be a politicized decision, but one that relies on science, data, and safety. And I want to thank Jordana and Josh for their presentation today, which really underlines those thoughts. A couple more thoughts from that we've had on this topic is that masks actually help avoid the spread of other diseases besides COVID. Healthier kids mean happier, more productive parents. When kiddos are sick or quarantined, it negatively affects the entire family unit. And I can say I heard from numerous single parents last year about the stress and strain that quarantines were putting on them, the most vulnerable of all of our students. Mask wearing also allows us to avoid quarantining when transmission is high, as it is right now. Last year, we had numerous pivots to remote learning as staff were in quarantines because their children were in quarantine or their students were placed in quarantine. And obviously, no one can leave the kids at home by themselves. Mask wearing is part of two main initiatives that we have going, and you've heard a lot about it today: increasing vaccination rates and mask wearing. We're continuing other layers of mitigation, but these two are our primary ones that we have control over. So we really appreciate this conversation today. Lastly, we respectfully request this board to approve a mask mandate for our students, staff, coaches, volunteers, and all visitors to our campus. And I know time is short, so that pretty much concludes my thoughts at this point.
Great. Thank you, David. I really appreciate you bringing it up, Superintendent. And it's BoH or BoH? Pardon me if I.
It's BoH, like BoH
Great.
humbug. Yeah.
Okay.
Hold the humbug.
Perfect for a superintendent. Thank you very much. And moving right along, we're going to go to, is it Brian Davies up next? Is he teed up for this?
Yeah, I am.
Oh,
I won't be as thorough as Dave was. But what I did want to say is that, we at Aspen Good Day, we took the initiative last year and we started with full pre-K to 8 in-person learning the last week of August, and we continued through to June. We had a mask policy for inside and outside, and this was in compliance with the Board of Health's direct health order, right, and Cd Phe recommendations. And when we had a number of positive cases throughout the year, tracking about 69 cases actually that we tracked throughout the year, all of those cases we could determine were because of outside of school contacts, usually adult to kids. We had no transmission of the virus at school. And we feel very firmly and very strongly that this was because of the mask mandate indoors. We live in a variable climate. Ventilation sounds great, but in the middle of winter when it's 15 degrees out, it's very hard to keep all of the windows and doors open. It's the kids can deal with the masks more than adults, is what we observed. And they need the social interactions. So going back to Jordana's and Pickens County Health's goal of keeping kids in school is our goal, right? We want them in school, in-person learning, because that is the best for their mental health and well-being, regardless if they have to wear a mask or not. And the only analogy I can truly come up with is we all make our kids wear helmets on their bikes, not because they do take a fall, because they might take a fall. And the long-term consequences of a severe head injury are significant. And so that's why we do things like that. And this is one step to do that. So we, as well, would greatly appreciate the Board of Health making a mask mandate requirement for schools in the local county.
Great. Thank you, Mr. Davies. And for those watching, I know we have 107 viewers online today. Brian Davies is the Aspen Country Day School Chief Operations Officer. Up next is Robin Strecker from Kids First and Child Care Health Consultant there. Robin, are you on?
I'm on.
Okay, great to see you.
Good afternoon, everyone. I'm just going to take a second to introduce myself and then I'll share a few short comments. Again, my name is Robin Strecker. I am a nurse and a child care health consultant for Kids First, which is an early childhood resource center here in the city of Aspen. In this role, I provide health and safety education and trainings for 11 licensed child care programs in our valley, located between Basalt and Aspen. So my work as a health consultant includes connecting child care programs with accurate, timely, and best practice health and safety information, according to the state child care licensing and sanitation rules, in addition to local public health rules and recommendations. I'm truly in a unique nursing position that directly impacts the health and staff of students in the early childhood programs I work with. So throughout the COVID-19 pandemic, I've had the opportunity to meet routinely with local K-12 school administrators and Pickens County Public Health regarding operation of schools and childcare. During these collaborative meetings, Public Health presents best practices that we review and consider. They provide answers to questions and they research further when we have more questions. And public health continues to provide us with specific county guidance regarding illness exclusion, vaccination, testing, contact tracing, and masking. All of this information has been super helpful for our programs. Collaboration among our childcare schools and public health team has proven important in providing consistent messaging and practices around how we protect our essential educators and our most vulnerable populations, specifically our children who do not have access to the vaccine yet. So I'm grateful for this unique partnership and common goal of keeping our students safe, not sick. Our child care programs understand that the American Academy of Pediatrics and our local public health department recommend universal mask wearing, regardless of vaccination status, for all people older than 2 years in public indoor spaces. Masks are proven methods to reduce transmission of COVID-19 and can make in-person schooling possible and eliminate the need to quarantine going forward. Classroom closures due to quarantine occurred frequently throughout the last school year, impacting childcare program operations and parents' ability to work when they had to remain home with their children. The American Academy of Pediatrics has addressed misconceptions concerning young children wearing face masks and states that most children aged 2 and older can safely wear cloth or disposable face masks for extended periods of time without impacting a child's lung development, ability to focus and learn, and also states the use of cloth and disposable masks does not impact oxygen or carbon dioxide exchange. So despite the disappointment of not being able to return to normal yet, childcare programs are passionate about protecting the health of their students and will continue to use layered mitigation measures, including masking when it is pertinent to prevent the spread of COVID-19 and other illnesses. Thank you.
Great, thank you. And for the listeners, Robin Strecker is Kids First Child Care Health Consultant and Nurse, and with 11 facilities throughout our valley. Thank you very much. Okay, Michael Hayes is up next. Michael, are you with us?
I am here. Hello, everyone. Good to see you all, and thanks for being here. My name is Michael Hayes, and I'm the Executive Director of Compass. We are the umbrella nonprofit that manages and supports the Aspen Community School, as well as our sister school down in the Roaring Fork School District, the Carbondale Community School. I wanted to just start by echoing my colleagues' sentiments and thanking the Board of Health and Pickens County Public Health, as well as my colleagues, for their excellent collaboration over the summer. It's been high quality work, and we truly have world-class educators and professionals. So thank you so much for all of your time. I wanted to just mention that as educational professionals, we share a sense of burden for the mental and physical well-being of our students. And we are, in addition, very keen and clear about the importance of sustaining and maintaining in-person learning. Indeed, that's our primary goal as an organization, to maintain in-person learning to the greatest extent possible throughout the school year. Masks allow us to do that for all of the reasons that my colleagues have outlined. I also want to emphasize points that have already been made by my colleagues about the economic well-being of our families. Keeping kids in school also keeps our families working. And by having universal masks for our families or for our students, we are supporting our families in staying at work. And I don't need to belabor additional points of my colleagues. So thank you so much for your time and consideration.
Great, thank you, Mr. Hayes. Michael Hayes, Compass Executive Director, Aspen Community School and Carbondale Community School. Thank you very much. Okay, Jordana, I wanted to insert here. I'm not sure if this is the place where we would want to put in comment that we've received. If you want to just, we don't have to go through every letter. I know that the board has been sent the packet of letters and it will be available for public viewing. We did receive public comment after soliciting it recently. Is there anything you want to add about that comment, Jordana?
Greg, just to your point, all of the Board of Health members have access to those comments made by the public. Those are available by clicking on the link in the agenda. For anyone who'd like to view them, it's if you click on mask usage public comments. And we have about 18 pages, last I checked, of public comments made. So this is definitely an issue where there is interest in the community. And from my reading of the comments, a lot of support for this going in this direction as well.
Right. That was what I was going to ask is, can you see a trend that you want to relate to us now? I scanned it, but I'm afraid to make any predictions about what the gist is here.
Yes, I didn't do a direct analysis, but just reading through all of the comments that were made, the majority were definitely in favor of masks, using masks in schools as a tool to be able to keep kids and staff in school and to not have to quarantine and with as much regularity as occurred last year. Greg, one more thing I'd like to just clarify before you turn this over to board discussion is define a little bit better the circumstances where this mandate would apply. So we're proposing that it would apply to K through 12 schools, both public and private, licensed childcare settings, home-based family childcare settings, license-exempt childcare programs such as single skill building and 72-hour camps, guest childcare facilities at ski resorts and courthouses, pods or other home learning, homeschooling groups, and extracurricular activities, including sports, where the participants are in grades pre-K through 12 over the age of 2 and older.
Great, thank you for that. So there we have it. If that's it, Jordana, then what I will do is open it up to our board. I'm going to try to figure out how to get board screen view here so I can see everybody. But if I miss somebody who has their hand up, please just announce yourself. I see Dr. Kurt has his hand up, so why don't we start with Dr. Tom Kurt?
I wholeheartedly support the CDC and the American Academy of Pediatrics recommendations as outlined by Jordana. And I also support what has been described by David, Bob, Ryan Davies, Robin Strecker, etc., about masks in schools without exemptions, and thereby I move what I have described with masks, no mask exemptions in schools.
Right, thank you, Dr. Kurt. Before I entertain a motion for something, I want to, certainly we can keep that. I'd like to hear questions and comments for anyone else. If somebody is moved to second it, we can, but we'll have the discussion after the second. But in case it needs to be amended in some way, I just want to keep it open here if I can. I'm looking for other hands. If anybody else has unfortunately, I only see Linda, Dr. Kurt here, so I'm still looking for the rest of you.
Patty had her hand up, Greg.
Okay, thank you, Krista. Patty?
I just wanted to say I want to encourage the voting members of the Board of Health to support staff's recommendations. You know, we've had parents throughout this last year and a half, especially during the school year last year, calling the Board of Commissioners, asking us to either keep the schools closed or keep the schools open, or a variety of things. And I think this is a wise and scientifically based decision to have everyone wearing masks. It's not that difficult a thing to do. I wish we could all return to normal and see each other's smiling faces every day, but I think the most important thing is to keep the kids in school and make sure that both staff and the kids at school are safe. So I support the Board of Health voting to, again, to approve staff's recommendations. Thanks, Greg. You're doing a great job.
Thank you, Patty. I appreciate it. And just so everyone knows, our Board of Commissioners had a conversation about this yesterday, and we had, while the same frustration that Patty expressed and I've expressed about having to go back to masks, but I think everyone, we have a consensus that this is an important step and that we do support it. Dr. Giesel, do you have a comment you'd like to make?
I would. I'm gonna let Jeannie's had her hand up, so
Thank you. Good. Jeannie, thank you, Jeannie.
Yes, so I totally support staff's recommendations. Schools are generally safer than the community, and I think it's very important to mandate vaccinations of staff within schools, and maybe consider mandating vaccinations of county and city employees. And maybe Aspen and Snowmass should think about what New York City is doing, or some Denver restaurants, and having people show their vaccination cards before being able to enter and have a meal. So the best thing for our kids is to get everyone vaccinated who's 12 and older, and that way we will keep our kids safe.
Thank you, Dr. Siebold. Dr. Giesel, do you want to weigh in now, or do
Yes,
we?
thank you.
Great, go ahead.
I just want to second everything that's clearly been said on this. I commend all the schools around here last year. We did a great job keeping the schools open. Masking was a big part of that. We have specific data on that out of North Carolina schools where they've studied it, but we saw the same thing here, where very few of our students who were quarantined actually tested positive. So I think that's a testament to doing this mandate again for this year. I did want to address some of the comments. Again, I read through all the public comments. Overwhelmingly, they were in support of a mask mandate. To the few that were not, I do feel like there's some information out there that I would like, as a practicing internal medicine doctor, to make sure everybody has. Most importantly, that the Delta variant is quite different than what we were dealing with last year. It is more infectious. Jordana did cite some information about infectiousness, which was based on the Alpha variant, if I'm correct, Jordana, and not the Delta variant, which we're thinking is as contagious possibly as chickenpox. So this is not the same that we dealt with last year. And I think our best way to keep kids in school for as long as possible is through the masks that we know work.
Great, thank you, Dr. Giesel. I'm looking through board, any other board members?
Linda Vera.
Thank you, Linda.
Thank you. I think if our goal is to keep children in school learning, that masks need to be used. I totally agree with everyone that went before me and their recommendation, and the American Academy of Pediatrics as well. And when you look at statistics as far as the flu vaccine and also the flu related illnesses in children and adults, it's obviously decreased in the last year because of mask wearing. So it not only helps with COVID, it helps with flu outbreaks. It helps in especially little children with RSV. And so I am absolutely 100% in favor of masking in schools. Thank you.
Thank you. Thank you, Linda. And I just want to point out for people listening in, Linda Vera is one of our voting Board of Health members, and you're been a nurse midwife and have probably helped deliver a huge percentage of Aspen in the Valley's population over 30 some years. So thank you for weighing in there. Do we have someone else? We've got Mayor Tory or Mayor Madsen. Tory?
Hey, thank you so much. I have a couple questions. I'll be honest. So when we talk about masking in schools, I feel a little less informed about this than just even general public and the work that we've done over the last year and a half plus. Let's see, I just wanted to have a couple questions. Perhaps we can get them answered quickly and move on. First question, some of these are referring to some of the letters that we got from the public. And this could be a question just straight to Jordana, and if she wants to call on somebody else, perhaps. Is there still a debate on mask effectiveness? One of the letters that we got actually did refer to what Robin Strecker was talking about this CO2 and air exchange and stuff. You know, I know that there's always the other side, if you will, but are we still talking about whether masks are effective or not? And do they have some other negative effects like the CO2 exchange that was brought up earlier?
No, Tori, and I see my physicians on the board strongly shaking their heads, so I might turn it over to Dr. Giesel or Dr. Siebold for a more complete response.
You want to go ahead, Jeannie?
Okay, yeah, either one.
So there was a JAMA Pediatrics article that just measured a little bit of CO2 inside of a mask, but when you take a breath, you take maybe half a liter of air in, and they're just measuring a little bit of CO2 inside the mask, and they're concluding that there's hypercapnia or increased CO2, and they've done multiple studies that dispute this in athletes and people where they actually take the blood and measure CO2 measurements. And I'm an anesthesiologist. I have done 14-hour cases with an N95 on, and I've been fine, and I've done that for years. So all of my surgeon colleagues, they wear masks all the time. If there were problems with masks, we would have fewer physicians. So I just don't think there's any issue with it.
Thank you. And you referenced JAMA Pediatrics. That's the Journal of American Medical Association
Pediatrics, which had this little measurement thing in a bunch of children who had surgical masks as well as other masks. And I think if your mask is made of cloth or paper and not saran wrap or plastic, you'll be fine.
Thank you so much for that. Next question I had for somebody on the board here is the Delta variant that we talk about. Everything that I've seen or the information that I've gotten really talks about the highly transmissive nature of it, the fact that the effects from it are worse than what we've seen in the first go rounds. Have we seen differences in kids and adults with the Delta variant? Because, at the beginning of COVID, people were like, kids, they barely even get it. They don't even notice it and all this. But are we seeing with the Delta variant, are we seeing that change a little bit? Are these symptoms registering greater in kids than they were previously?
Who wants to take that?
Krista, do you want to take that one?
I'm happy to. I would say, the overwhelming evidence is yes. You can hear the news reports out of Texas, out of Florida, Alabama. We've had the highest rates of hospitalized children and children in the ICU than we've ever had. What I have been reading through the medical channels and all the information I have access to is we will see many more symptomatic cases. The Alpha variant, first of all, was not as infectious, so not as many people were able to transmit it to each other. We've seen that from Josh Vance on these slides before. This one's much more infectious, but at the same time, we are going to see more symptoms. We are going to see more sick kids, and we hope that we don't see more hospitalized kids, but this is a much different virus than we were sitting here talking about last August.
Thank you very much for that. Next question that I would have may go to David BoH or somebody else, but has there been any consideration, and this again comes from one of the letters that we received, for treating different age groups differently, thereby high school versus 12 and under, right? Vaccination available for those that are 13 over versus those that aren't. Was there any discussion around different masking mandates for those that can be vaccinated, older grades, or was that reflected in the slides that were shown about the 70% vaccination? So if the high school gets to a place of 70% vaccination, does that mean that they will be looking at perhaps different circumstances?
Mayor Tory, great question. There has been consideration of that. The CDC guidance is pretty clear about going with all. A couple of key points, though, to keep in mind. Pickens County Health's guidelines and recommendations suggest that, if we can get the 70% vaccinated within a building, and a lower transmission rate within the community, then we can remove the masks. And so to further that work, what we've done is we have mandated vaccinations for all staff. We did that on Monday. All staff have to have at least the first vaccination by the 19th of this month. So we are doing all that we can to get our vaccination rates up there. And we think we're going to clear the 70% threshold in the high school. Our middle school is a mix of 11 and unders and 12 and above. So it's going to be hard to clear the threshold at the middle school. And then obviously in the elementary school, none of the children are vaccinated yet. But the other thing to keep in mind, and why we're asking for all means all, is that our families share students across the schools. So I could conceivably have a family with students in community, in country, and in our building. So that's one family unit. And so, you know, obviously they're going to take their masks off at dinner. You know, so that's why we're asking for all across the schools. And, you know, we're requesting to start out in masks. And if we can get rid of the masks when the thresholds are safe, then we can move forward in a mask-free environment.
Thank you.
I think that answers
thank you.
that question.
Yes, that's perfect. Just two more quick ones. I don't know if I missed this. Did somebody reference the school board? Did the school board weigh in on this?
So the school board is supportive of it. And, you know, one of our thoughts is that, you know, sort of medical policy should be coming from this group rather than from the school board. If we have to, we can do it on our own. And we believe in it firmly enough that we would probably have to go there, but it would be a lot better if we had the support of this governing body. You know, the school board's really good at school stuff. We're not as good at the medical stuff.
Okay, thank you for that.
If I could, Tori, for a second, just so David, if I could, if we approve this, I assume you'll take it back to school board and the school board will ratify it or support it, because really I think it's important that the entire community be on board with the decision we end up with, and I'm hoping that they can express that in some, you know, form that we can share.
Absolutely. I'm sure that the board will support this publicly at our board meeting on the 17th.
Thank you very much. Tori,
Thanks.
go ahead.
Yep. And then last one, about school schedules. Multiple schools, not just in our area, but around the country, are going back to school primarily this month. Some are still delayed until September. But we see kids going back to school now. Then we have a small break, Labor Day weekend. We have the holiday breaks that come up after that. Are we sticking to primarily a traditional school year schedule, or have there been any modifications? And the reason I ask is in the sense of, you know, last year we had those episodes where we went on breaks, whether it was spring break or whether it was winter break, and then getting back into the schools, I don't know, was maybe problematic for some. We were very proactive about testing last year, but what are our plans for kids being in and out during breaks and coming back to schools? Is there anything different this year?
So at this point in time, our schedule is a traditional schedule, and part of that is because of the fundamental interconnectedness of the multiple schooling organizations, and predicting where we're going to be, you know, after the week in November or the couple of weeks in December, January. It's too early to say. I think I'm looking to Jordana to nod her head yes. But, you know, it's a little too early to predict that. All of the schools can pivot to remote learning if we have to, and if transmission rates are cranking through the roof again. But at this point in time, we have the traditional sort of schedule on the docket. And again, that's where this masking piece comes in so helpful, because if we're in masks, we think that the transmission rates in the schools, we believe, and we saw it last year, the transmission rates in schools will be much lower. You heard from Country Day, who opened pretty close to fully, if I'm not mistaken, right out of the gate last year, fully masked. And then our elementary school started out in masks, and pretty soon they were up to full everyday instruction, but fully masked and with very, very low transmission rates. So that's why we're doubling down on the masks at this point.
Great, thank you.
Thank you.
Great. Tori, is there more or?
No, I would just share, the last thing I would share is that, as I spoke before, I think my council feels a little less informed about the school dynamics than maybe we are about our general population. But even knowing what we don't know, at this time, I'm going to support the recommendations and do that on behalf of the Aspen City Council. And we'll see how we get back into the school year.
Great, thank you. Thank you. And thank you for your questions. You did ask one, or David alluded to that, if things take a wrong turn, we're able to pivot back to teleconferencing and remote learning, but certainly that is not part of this plan. Our plan is to get the kids back in school, and that's a great message to get out there. And it leads to one of my questions, which was, it looks like we have incentives. We've got the carrot. We're going to dangle the carrot out there. If we can all get vaccinated and we can all wear masks and follow the steps, it's going to lead to a healthier population and a quicker return to what we call normal, perhaps maskless and a little bit more carefree activity, perhaps. And I want to make sure people understand that hopefully people will be incentivized to participate and really protect the community here. That would be my wish. Anyone else have a comment they want to weigh in? I can take if we're ready to, I can accept a motion if it needs to be revised, or just go with Dr. Kurt's original motion that this be accepted, that this recommendation from staff be accepted. But
Mayor Madsen has a hand raised.
He did. I didn't. Sorry, I'm not seeing the hand raises. Sorry, Bill. Didn't mean to leave you out there.
And also,
Sorry,
just
that's
want to
okay.
let you know that Dr. Levin is on the line, if she may be able to make a comment after Mayor Madsen.
Okay, great. We'll do that before we make any motions then. Thanks. And thanks, Bill. Sorry, I didn't see hands up.
Yeah, no problem. Actually, Tori asked my question about vaccination, and superintendent gave a very good answer. So I think that was great. I really appreciate the extensive explanation. I think that the public comments that we received were quite extensive as well. And I think that the staff through their presentation has done a good job answering those questions, and hearing from the heads of our schools, I think, is super important. So thank you for that. I really liked Mr. Davies' analogy there about wearing a helmet and being similar to wearing a mask. So I would like to go ahead and second Dr. Kurt's motion for the mask mandate.
Great, thank you. So I do have a motion to support this and a second. Is there any other conversation? And once again, I'm not seeing hands up. I see only a fraction of the faces that are on our panel today. So if you have
Can we let Dr.
another
Levin
comment.
comment?
Thank you. Thanks for the reminder there, Kristen. It was only 30 seconds after it was suggested. Kim, we cannot see you there, but please, we hear you, hopefully.
Yeah, can you hear me okay?
We can.
And we see it.
Okay, I do have my video on. Yeah, I'm in work here, but I've heard just a few of the comments and just weighing in with what I think everybody else has weighed in. I want to applaud everybody for really strongly supporting masking in schools. I think it's of utmost importance. It is consistent with the values of our community. We know masks work. There's evidence that masks work, and it is really a critical step in protecting children, keeping children in school, educational, social, emotional, economic reasons for all of the above. So I applaud all of that. I also hope to continue conversations with masking indoors as well as another topic in the upcoming weeks in general. But at this point, I I completely agree that it's a different beast right now. There's the Delta variant is different and it is more aggressive. And unfortunately, as we've seen from national data, it is morphing into more of a pediatric illness with the increase in hospitalizations and very serious trends in that direction. So all of the points that everybody else has made, I believe, I fully support. Thank you.
Great. Thank you, Dr. Levin. Thank you for joining us. Okay. I'm going to put it out. Yes.
I just want to make a clarification of Dr. Kurt's motion before we go forward, and just put up the staff recommendation on the screen and ask if that is what Dr. Kurt was recommending that we move forward with.
Great. Thank you for that. Thank you for being thorough. And Dr. Kurt, if you wouldn't mind letting us know if this is what you were recommending.
Yes, I was in favor of all except for the exemption, because we're going to be having visiting teams, visiting schools, and let's go through the first month with the mask mandate and no exemptions and see how September, we work out through September.
Thank you. And if that's the understanding of the motion, I just want to make sure that, do we have to add any more comment? Are there any issues that come up with that, Jordana, that we should discuss now before we pass that without the exemptions as stated?
I just had one question, I guess, just a point of clarification with outdoor sports. And so is outdoor sports, because I think Jordana at the end of that said that this was going to cover, K through 12, all the licensed childcare, home care, and then sports. So I just want to clarify, maybe outdoor sports or just sports in general is going to fall under this as well with no exemption?
Masks are not included for sports at this point in time. That's where we're looking at those testing protocols, at least for our students in our school district, not relevant to other, what requirements would be for other school districts. And so Dr. Kurt, just to clarify, what I hear is supporting that the public health recommendation with the consideration to re-examine vaccination and incidence rates at the high school after October 1st.
You'll have to unmute, Dr. Kurt. Oh, you're still muted.
That is correct. Did you get that?
Yeah, we got it. Thank you. Okay. I did want to just clarify, having brought this up, if a visiting sports team comes and plays a football game with our team, is this how will our requirements affect them, and will by chance be different from what they're used to or what their protocols are? I'm looking for I don't want to go too deep into this, but it brought up a question.
An outdoor sport, this would not apply.
Wouldn't apply. If they came into the school for any reason, they'd be masked up, right? Like any visitor. Okay.
That's correct. That's correct.
All right. Thank you. So I don't see an issue with that. Okay, then, if that's it for comment, I'm scanning my screen, and if you have your hand up and I miss you, please yell at me. But I'm ready to call this question from our Board of Health members, voting members. All in favor, please raise your hand, your right hand. And I have a majority, if not a consensus. I think we have a consensus here, and I'll do the same. So that passes, and the recommendation of our public health department passes with the support of the various schools and our superintendent of schools and our child care facilities. And I want to thank you all for going through this process. I think showing a unity and support throughout the community from this esteemed and knowledgeable group of people is incredibly important going forward, and it will help us remain with our resolve to get through this, and hopefully we'll come out of it and we can adjust this. We will adjust this as necessary. So these measures I think will only be in place as long as we feel they're absolutely necessary. Thank you all very much. Tori, question?
Thank you. Yeah, real quickly, on behalf of the council, I just want to let people know, we've heard the comments from people that are not supportive of this masking, that have concerns around this as well. We're understanding and sympathetic, but we are going to move forward supporting this, as I said before, in the overall community good and what we see as a pathway to keeping our kids in school. And we think that's a great first step. We also understand that there needs to be flexibility and understanding as we move forward. And to that end, Greg, Dr. Tom was talking about October 1st. Is there any way that we could have some sort of coordinated check-in? Can we get some feedback and some information coordinated as the schools do go back in session? Is it possible for us to maybe just get a weekly update, how it's going? What are we seeing on the ground? Because for the majority of us, we are not in the schools. We are not seeing how this really rubber meets the road. And so if there's any way that we can really hear about what's going on a weekly basis, I think that would be really great.
Great, thank you, great suggestion.
I agree with that.
Thank you, Dr. Kurt, and Linda's nodding her head as well. I think it'd be great if we can have frequent check-ins, just so we see how we're doing with that. I think that'll help the community understand the importance of it. So it looks like it's back to school and back to masks and continuing to support the health of the community here. Once again, thank you all for that. We're going to keep moving, pull my agenda back up and see how we're doing. I think we're exactly on schedule. Jordana, you made a very great agenda today. How are we doing this? All right, Jordana is going to speak about COVID planning and partnership updates for a successful fall and winter. Take it away.
Thanks, Greg. I think as Jeannie started to talk about, we're starting the conversations about what does it look like to have a successful fall and winter? What are the protective measures that we need to have in place? And how do we work with our businesses, our municipalities, our employers, our organizations to be able to put in protective measures that are going to allow us to continue to be open to tourism, and then also protect against the potential negative impacts of having what we've seen of how transmission has increased as our mobility data increases as well. And so I just wanted to update the board that there is a fall and winter planning meeting that is actually, we're calling it a winter planning meeting that's happening tomorrow with some business leaders, chambers, municipalities, RAFTA, and to be able to really start this conversation. I will also be presenting to the ACRA board at the end of the month in August. This planning will be moving forward. The other thing I want to recognize is that there have been a number of businesses or organizations who currently have policies that align with the CDC mask guidance of when incidence is substantial or high, requiring masking in indoor public settings. We've got some other businesses and organizations, as Dave Bao shared, that are requiring vaccinations for employees. And I think there's more conversations, and we'll hear about more of those efforts of different organizations and businesses in the near future. And then, also to continue to recognize our performing arts community who had this conversation in preparing for summer about what are the vaccination verifications that can happen, so that, when we do have people in close proximity of each other, we are assuring as safe of an environment as possible. So that is the next conversation that we have teed up. I'd just like to that's the update there, Greg. If there's any other comments from the board, we can do that and then roll into round robin.
Great. If I could just say to follow up with that, you made a point to me earlier in conversation that what we're seeing is that vaccinated populations that are vaccinated to 100% are seeing breakthroughs, and it's pretty much attributed to visitors to those populations. So we can do incredibly well in our community with vaccination and being safe. But with the huge influx of seasonal visitors coming through, we're vulnerable once again, and it lowers our resistance to this. So I think part of that conversation is going to be, what can we do to incentivize people coming to visit us to do the right thing to protect us and to protect themselves by coming vaccinated and once again testing. And so that's going to be part of the conversation, I'm sure. Thank you for that. I'm ready to go into round robin. I have a couple of things I can throw out, and if you'll let me start to get the juices flowing. One is that there's a vaccination clinic coming up at the school. I think is that on the 18th, next Wednesday. They were looking for helpers to work it. I've signed up to help. I don't know if it's going to be the Vax Bike, but if you haven't worked with the Vax Bike yet, it's the modified, what do you call it, retrofitted popsicle cart that's turned into the vaccination bike that comes with nurses and coolers, keeping it at the right temperature and all that stuff. That's going to be at the hospital, and they may still be looking for help. And we have other clinics coming up as well.
Greg, can I just clarify?
Yeah, oh, sure. Yeah, please.
That clinic next week on the 18th will be held at the Aspen Middle School from 10 a.m. to 2 p.m. Can't guarantee the Vax Bite will be there, but it will be at the community picnic on the 19th.
Okay.
So yeah, Tori, we'll see you there.
Greg, I hope you'll still go. If the bike's not there, I hope you still go.
I want to ride the thing in. I want to ride it into the school. Yeah, no, it's kind of fun. It's also fun to be there and talk to the community who come up, whether they've been vaccinated or not yet. But I think it's really great to mingle with the people who are concerned about this from our community. Another thing that Jordana didn't mention earlier is that I think in the state, we're not the first to do this mask mandate with the schools, and it was Boulder County might have been the first. Is that correct? I think she's nodding her head yes.
Yes, I'll just correct.
Okay, that's all right. The other two things I wanted to ask were, what are we thinking that CDC has in mind for approval for younger kids' vaccinations, and then also for booster shots for the vulnerable immunocompromised? Can you tell us anything about what's in your crystal ball for that?
For kids younger than 12, we're hearing winter, potentially December. But that timeline is a little, hasn't been totally confirmed yet. What we think is in the more near future is the approval of booster doses for individuals with specific immunocompromising conditions. And we expect that guidance to be coming out as early as Friday.
It's Friday on that one. So we'll look for that. And then I lied to you. I had one more question. That was just regarding upcoming fall events, events with large groups of people. How are we doing with that? Anything you can tell us about, reports from the events regarding their protocols, or how are things changing or going there?
So we're continuing to do some updated outreach to the events that are happening, especially the larger ones, knowing that the landscape has changed since many of them have submitted their protocols and permits. So that outreach is ongoing, and I know that we have had some requests for events that are being scheduled and coming out, and there have been some very specific inquiries about what are all folks who are wanting to put on events, but wanting to put in place all the potential protective measures of requiring vaccination of all attendees and a rapid test, and just on and on. And so we continue to be available for any kind of technical assistance and support that we can provide one-on-one to anyone looking to host an event in the safest possible manner in our community.
Great.
Jordana,
So as we
sorry.
go ahead, Krista.
I was
go
just
ahead.
wondering, do you still require them to submit proposals for approval prior to larger events?
Those are required for anything that requires a special event permit through the county and I believe the city as well. Yes.
Great, thanks. And I think as a record, our community has been very safe with our large events going through the pandemic and all the way. I think the protocols and the safety measures have been working. So as we go into back to school, and then we have Jazz Aspen and their festival, and then we have the Food and Wine Festival coming up, we can expect they're going to be following the safest protocols to conduct those events. And I think public health is engaged with them on that. Okay, round robin. That was my several questions. Dr. Kurt?
I'd like to comment on COVID in children, because I get communications from Texas because I practiced there for 25 years before coming back to Colorado. Houston Children's Hospital is full, and that's in contrast to what happened with the earlier portion of the epidemic, the pandemic. And in addition, I'd like to point out the CDC has issued recommendations for indoor masks. And while we did not necessarily take action on that today, I would support such an encouragement or voluntary participation of people wearing masks indoors, because we know that people have been doubly vaccinated, can be carriers indoors and not necessarily know it. And I'm happy to see that such efforts are being partially enforced as they are. The Jazz Aspen Snowmass thing is occurring with their indoor portions, and with the reactivation of the Wheeler, where I'm on the board as well. So thank you Greg, for chairing a very productive meeting, and greetings to all for the next month.
Well, thank you, Dr. Kurt. I do appreciate it. And regarding advisories regarding masks indoors, Jordana, is there anything this board should consider, or is it something that our public health department will do independently?
At this point in time, we've been communicating that we are promoting the CDC guidance of voluntary, masking indoors for everyone, regardless of vaccination status. So we support that CDC recommendation. That was a lot of the reason behind the move to align our what do we call it? Our risk level monitor on our website that John Anderson showed you earlier with the CDC, so that it can be very clear when we are in substantial or high transmission levels that masks are highly recommended to be worn in indoor settings.
Great, thank you. Round robin still open here. We're actually ahead of schedule. Dr. Kurt, if you have something else.
I just remembered the Pfizer vaccine is likely to be regularly approved by the FDA either in the last week of August or in September. So the emergency use authorization will be now fully approved for the Pfizer vaccine, and there won't be the possibility of any litigation of people necessarily opposing as that occurs, particularly in the military or in occupations which are dealing with exposures such as hospitals.
Thank you for that. Tori, Bill, Patty, Jeannie, I'm looking at my Tori, you are up next.
I appreciate it. I guess the only things that I have is maybe on the tail end of what Jordana was just saying. I want that message to be out there that, using a mask is recommended in a lot of situations. And I think that also part of that is that, by us supporting that recommendation, it just gives people the ability to feel comfortable, right? We still have the somewhat of a divided community in that. And so I think it's just important that we make people feel comfortable. If it is their choice to wear a mask, then we need to be supporting that. You know, I myself, I went to the grocery store last night and, you know, just put on my mask out of consideration. And really, I guess I'm one of those that I feel it is my personal choice, and I choose to do so. So, you know, I just want to make sure that people in our community understand that we are not mandating, but it is a recommendation for what's going on. And I have one other item, but I think that's what's most important to me is just letting people know that we are looking at that and that we are not mandating, but the recommendation is in place.
Great. Krista.
Yeah, I just kind of, along with this masking conversation, so the whole point is what we are trying to do is reduce spread of the Delta variant, correct? And I think this kind of goes back to Josh Vance's presentation about the long haulers, and that there's just a larger majority of people that can get the Delta variant, especially if they are unvaccinated or if they're vaccinated and have breakthrough cases, and this is not something we want to get. Even if we don't get long hauler syndrome, I think it's important for people to know that long haulers is defined as something that occurs 4 weeks after you get exposed, which means that even if you really have mild symptoms, those symptoms can persist for 4 full weeks, which means you can't exercise like you usually do. You can't get your heart rate up. You can't go to the gym. You can't play your sports. Getting this virus is a big deal, even if those are asymptomatic, and that's the whole point of the mask. So even if we don't end up with this long hauler syndrome, it is a 4-week chunk out of your life that, you know, it can affect you drastically. It can affect your neighbor who may be immunocompromised even worse. So this is a bad virus. We have bad options, but I think we need to continue to remember why we're doing what we're doing.
Great, thank you. And that's a great reminder. And certainly I'm hoping that any media journalists watching this would share that bit of information with the public, that this is why we're taking this as seriously as we are. And yes, we're behind, what I'm reading is that we are behind this mask recommendation, as Tori points out, for the community and indoor spaces. Or whenever you feel like you need a mask, you should probably wear one, right? So, all righty, I think my screen went blank here. It'll come right back up. Can you tell us about our next meeting date, Jordana? Oh, Tori's back with another question. Go ahead.
Yeah, sorry, I just got a message. Let's see. I just got a message here. I want to just throw this out for Jordana because I haven't confirmed it, but to just share with Jordana, I just got a message that somebody has gone on to the Pickens County website looking for testing information in our area and thought it was very difficult to find adequate testing. And then separately looked at the state testing map, and apparently they have 0 locations listed in Pitkin. I don't know. I haven't confirmed that. I just want to share a message that I just got.
Testing is still available in Pitkin County. Dr. Brooke Allen runs the free COVID testing behind Aspen City Hall. We're actually in conversation right now to see if that currently that is a microgen spit test where you spit into a little tube, get sent away, and you get the results via PCR, which is a very reliable test. Several days later, an average of like 2 to 4 days is what that turnaround time it typically is. Dr. Allen is looking to see if there can also be an option for those that are symptomatic to also offer a rapid test in conjunction with that PCR test at that location. That would be something that's new because we've been hearing feedback that finding a rapid test is more difficult than finding this free option that has been in our community for a very long time. Additionally, there are some private testing sites, but they do charge. And so that serves a portion of our community who find that to be convenient and helpful. Additionally, your doctor, or if you have contact with public health with an exposure, can order a test through Aspen Valley Hospital. So if you have symptoms and you're seeing your provider, you can get a test ordered through Aspen Valley Hospital, and the providers there will select the most appropriate test for you. Additionally, we are, as we mentioned, working with schools to figure out what is going to be the most effective, reliable, and easy way to test kids as they're back to school and potentially symptomatic, either with COVID or other symptoms. So how are we, if we're requiring a test, if you're symptomatic to come back to school, how are we making that easy to access? So that is still being worked out and determined in conjunction with our school and childcare partners.
Great, thanks, Jordana. I point out, somebody asked me, somebody called me the other day, the smoke had made him feel sick enough that he thought he might be getting COVID. And I think we've seen a lot of those cases with the heavy smoke and respiratory issues. I referred him to PitkinCounty.com's website. And he found the testing right away and got tested that day, and had a rapid test and was in and out, and got back to me a couple hours later, said, "Thank you, I'm negative." And, you know, so I know they can find it on the website, but even for me, sometimes it's difficult. So we'll do all we can to keep it, to make sure people can find their way around, but it is possible to find testing here, and it's published on the websites. Thank you. Anything else? Round robin comments? And Dr. Kurt again.
I'll mention that purpleair.com, which is used by Kurt Dahl, is a private sector way of testing the particulates, the PM 2.5 in the air. And there are several sites in the Roaring Fork Valley for that. So if you go to purpleair.com, which is operated out of Salt Lake City in Utah, you'll quickly get your air quality in this area.
Thank you for that. And while you're on the topic, while we're talking about the air quality with the smoke, which has been very noticeable lately by me, certainly trying to sleep at night's been tough lately. I think it would be helpful if public health could, to pivot a little bit from COVID to air quality. We have so many Uber athletes here who are riding their bike to the top of the pass or to the top of the mountain or running to the top of the, you name it. How is PM 2.5 affecting their breathing? I liken it to it'd be like smoking a pack of cigarettes or something. So I have not been getting aerobic exercise the last week or two, unfortunately. Do we have a recommendation that we can share and publicize? How do we handle this? Is it okay to go out and breathe deeply in this smoke?
Thanks, Greg. Dr. Kurt, Purple Air is an option. The other website that we've been promoting is airnow.gov. That's very simple and easy to use. That shows the current air quality along with the recommendations for when it would be safe or not to be able to go out and exercise. You can also sign up for Pick-in alerts. And as we have, when there are dangerous levels of when air quality reaches a dangerous level, signing up for those Pick-in alerts allows you to get an email or text, whatever you choose, to be notified that you should be able to check, and that gives you more details as to what kind of activities and what populations may need to think about indoor activity when that air quality is more dangerous.
And I know there was a Colorado Public Health advisory that we were notified about for our area as well. Patty?
Yeah, I was just going to say what Jordana just said, because the Pickens County alerts do come out and they advise people to stay indoors and not do strenuous outdoor activity. So that would kind of be a guideline for anybody who wants to run up a mountain, ride up a mountain, or just some people just even go out and do, extensive yard work on days that are really bad. So the Pickens County alert it was very wise to put these public health air quality notices out, and I think it gives good guidance to people.
Great, thank you. Okay, from the group I can see here, I don't see anyone else with a hand up. If speak up now, here's your chance. Meanwhile, tell us about our next meeting date, Jordana. It has my name next to it, but I don't know when it is.
So our next monthly meeting is September 9th from 1 to 3:30.
Okay, thank you. September 9th, folks. Hopefully we will have no need to see you until then, but we'll probably be hearing from Jordana and certainly emails back and forth as necessary. With that, I can't remember if I need a motion to adjourn or not, but we may as well. I'd accept
I'll make a
one.
motion.
Krista, thank you. Second from Dr. Kurt. All in favor, right hand.
Very good.
Thank
meeting,
you all.
Greg. Very good. Thank you.
Thank you. And we're actually finishing at 6 minutes early. I get 6 minutes credit, I think. Thank you all, and we'll see you soon. Take care.
Thank you very much.